Good morning to all. My topic is ocular abnormalities in children with developmental delay aged between 1 and 18 years. The ophthalmic disorders are common in these children with developmental delay, and knowledge of their visual problems is essential if these children are to be given optimal support. But assessment and management of visual deprivation in these children is a complex challenge. For that, our aim was to describe the presence of ocular abnormalities in children with developmental delay, and our objective was to analyze the risk factors and systemic associations that may be contributed to delay in the development and the possible treatment that can be delivered. This was a cross-sectional study of 94 children done between September 17 to October 19. We included children with developmental delay diagnosed by pediatrician and or neurologist in the age group between 1 and 18 years. In the methodology, we included detailed history including birth history, detailed anterior and posterior segment examination including UCV and BCV were noted down. Dilated refraction after putting tropicamide or ROP drop followed by punctum occlusion was done. Glasses and low vision trial amblyopia therapy surgical correction was advised wherever required and feasible. Mean age of the study group was 5 years plus minus 4. 33 children were female and 61 children were male in our study. Out of them, 74 children had BCVA less than 6/60 in better eye, and we found fixating and following light was the commonest UCVA and BCVA in both the group. 88% children had one or more ocular abnormalities. Out of them, most common was the refractive error in 70 children, followed by strabismus in 39. Optic atrophy was the commonest posterior segment finding, and delayed visual maturation and corticovisual impairment was seen in 13 and 11 children respectively. Low birth weight was the commonest risk factor, and the epilepsy was the commonest systemic disorder in our study, and we found out that abnormal neuroimaging in 47 children. We advised visual discrimination exercises in 65 children, followed by glasses in 39. LV trial was possible in 3, and patching, cataracts and skin surgery were advised in 12, 5 and 3 children respectively. To compare with the other studies, our results in developmental delay children were similar and comparable with a study done in India by Hegde et al. To conclude, 88% children had ocular abnormalities. Out of them, 74% children had refractive error, which is quite high than the normal kids. So we recommend that regular school screening in government and private school in both rural and urban areas. Like any other study, we have a limitation. Number one, not graded the developmental delay, and it was not a longitudinal study. Still, this study highlighted that importance of eye screening in rehabilitation centers, no adequate numbers of rehabilitation centers and unequal distribution, importance of creating awareness amongst healthcare workers and general population. Therefore, integrated approach in early diagnosis, appropriate management, analyzing the risk factor and prevention to bring about an overall development in these children. These are my references. Thank you.
Thank you. What you have highlighted there is that we need to do school screening of children.
School screening and that rehabilitation center screening, and that is also very important.
What? Sorry?
To stabilize the rehabilitation center for these kids.
Okay. No, but first of all, they have to be filtered.
Yes, ma'am. Definitely.
They have to be diagnosed.
Yes, ma'am.
So, how do you suggest that preschool screening should be done? Any ideas?
In Anganwadis, we can do one thing that we are doing, ma'am, in Anganwadis.
Means you are training the ASHA workers to
Yes, ma'am. Yes, ma'am. For that. Yes,
screen for vision.
In Anganwadi, we are training the ASHA workers, and we are doing Anganwadi screening in school.
So, and what chart have you given them then?
Ma'am, preferential looking we are asking for all the there. It is not for developmental delay kids. We are just asking them to check that visual behavior of the kids or reflex. If they found any white reflex or broken reflex they found, then
like
we are doing that. We are doing, and this study has been done in our institute only. The patient who are referred by pediatrician or neurologist.
No, I was under the impression that you all are going a step further. It's okay, fine.
Actually, it is a very broad spectrum he has selected, 1 to 18 years. So, it is a very broad spectrum of the age group.
Yes.
So, if you can divide it from 1 to 6, 6 to, yeah. So, that will be more better. Like,
Yes.
In fact, I have always felt that each child needs to be screened preschool,
Yes.
and then again at first standard when they go from prep to first, again, and then actually every year after that. So in fact, I had this project in mind when COVID started in Aurangabad. I was planning to do it in all the ZP schools, the Zilla Parishad schools, that give them a chart, just a normal vision chart, cardboard wali, which is very cheap, and corporation was ready to buy that for their schools, and train the teachers of the school to at least check vision, so that we get a rough idea if there are any visual problems.
Right.
So I think this would still work, but it has been delayed because of COVID, but I plan to implement that. I feel that should work to a good extent. Anyway, thank you.
Thank you.
Thank you so much.